Jiao Channel. Jiao 1 is the yin well and metal point of the Jiao Channel. It is located on the dorsal aspect of the ring finger at the junction of lines drawn along the ulnar border of the nail and the base of the nail, approximately 0.1 sun from the corner of the nail. Jiao 2 is the yin spring and water point of the Jiao Channel. It is located between the ring and little fingers, 0.5 sun, proximal to the margin of the web. This point is usually located and needled with the hand resting in a loose fist. The point may then be located at the proximal end of the visible crease formed by the web space. Jiao 3 is the shoe stream and wood point of the Jiao Channel. It is located on the dorsum of the hand in the depression just proximal to the 4th and 5th metacarpopharyngeal joints. Locate and needle with the hand resting in a loose fist. This point may be located at the apex of an equilateral triangle formed by this point and the prominences of the metacarpopharyngeal joints of the ring and little fingers. Jiao 4 is the one source point of the Jiao Channel. It is located on the dorsum of the wrist at the level of the wrist joint in the depression between the tendons of extensor digitorum communis and extensor digiti minimi. Follow the interspace between the 4th and 5th metacarpals proximally from Jiao 3 into the depression at the level of the wrist joint. This depression may be more clearly defined by extending the wrist and fingers, but the point should be subsequently be needled with the tendons relaxed. This is Jiao 4. Jiao 5 is the lunar connecting point of the Jiao Channel and the confluent point of the yang linking vessel. It is located 2 sun proximal to Jiao 4 in the depression between the radius and the ulna on the radial side of the extensor digitorum communis tendons. The point is located between the radius and the extensor digitorum communis tendons, close to the border of the radius. Jiao 11 is located with the elbow flexed 2 sun proximal to the olecranon and 1 sun from Jiao 10 being at 1 sun above the olecranon. Now we go to Jiao 14, which is located at the origin of the deltoid muscle in the depression which lies posterior and inferior to the lateral extremity of the acromion. Locate the arm within the arm abducted in order to enhance the depression. Note that large intestine 15 is located in the depression which lies anterior and inferior to the lateral extremity of the acromion. This is Jiao 14. Now we're back to Jiao 12. Jiao 12 is located on the upper arm on a line drawn between Jiao 10, which is at 1 sun from the olecranon, and Jiao 14. 4 sun proximal to Jiao 10 and 6 sun distal to Jiao 14. Divide the distance between Jiao 10 and Jiao 14 into half and locate this point 1 sun distal to this midpoint. locate in the depression within the triceps muscle posterior to the shaft of the humerus, between the muscle bellies of the long and lateral heads of the triceps. This is Sanjiao 12. Sanjiao 13. Sanjiao 13 is the meeting point of the Sanjiao Channel and the Yang linking vessel. It is located on the upper arm where the line drawn between Sanjiao 10 and Sanjiao 14 meets the posterior border of the deltoid muscle, approximately 2/3 of the distance between these 2 points. Locate in the depression within the triceps muscle, posterior to the shaft of the humerus, between the muscle bellies of the long and lateral heads of the triceps. Although most sources specify both a distance of 3 sun from Sanjiao 14 and a location at the posterior border of the deltoid muscle, these do not usually correspond. In practice, palpate the region of this point to find the most tender location. Now we go to Sanjiao 15. Sanjiao 15 is the meeting point of the Sanjiao and gallbladder channels and the Yang linking vessel. It is located in the suprascapular fossa in the depression midway between gallbladder 21 and small intestine 13 at the medial end of the suprascapular fossa. This point may also be located midway between the lateral extremity of the acromion and do 14 and 1 sun posterior to gallbladder 21, which is at the highest point of the trapezius muscle. This is Sanjiao 15. Sanjiao 17. Sanjiao 17 is the meeting point of the Sanjiao and gallbladder channels. It is located behind the earlobe, between the ramus of the mandible and the mastoid process, in the depression just superior to the palpable transverse process of the first cervical vertebra. Fold the earlobe forwards to reveal this point. This is Sanjiao 17. Sanjiao 20. Sanjiao 20 is the meeting point of the Sanjiao, small intestine and gallbladder channels. It is located on the side of the head, directly level with the apex of the ear when the ear is folded forwards. Fold the ear so that the posterior part of the upper helix directly covers the anterior part of the upper helix. Take care not to push the whole of the ear forwards. This is Sanjiao 20. Sanjiao 21 is located in the depression anterior to the supratracheal notch and slightly superior to the condyloid process of the mandible. In order to locate this point, ask the patient to open the mouth so that the condyloid process of the mandible slides forwards to reveal the depression. This point is needled with the mouth open. Following needling, the mouth can be closed. This is Sanjiao 21. And finally, Sanjiao 23 is located in the depression on the supraorbital margin at the lateral end of the eyebrow. With Sanjiao 23, we covered the Sanjiao Channel.